All right. Hello there. Welcome to our latest chat with Moms of the Mic. Um, Hoping that people take a moment to join us and join this live chat because we are talking about a very important topic, aren't we, Marissa? And we'll introduce our doctor in just a moment, but why don't you give some our listeners, our watchers, just a heads up what we're talking about here?
Sure. Essentially, today we're here for parents and their kids in elementary school age. We're talking about Pfizer's COVID vaccine for 5 to 11-year-olds. For those of you who may not be up to speed, Pfizer is asking for emergency use authorization from the Food and Drug Administration, specifically for their vaccine for 5 to 11-year-olds. And it is a vaccine that is a smaller dose. It's about a third the dose of the adult and adolescent vaccine that's out in the market right now. And as far as we know, October 26th is the target date right now for the FDA to take a look at all of the data that Pfizer has collected through their trial, which involves about 2,500 children. And so as soon as the last week in October, there could be approval for this for those in elementary school, which is a really big deal when it comes to protecting against coronavirus for that age group.
Yeah, and so we know that parents have lots of questions, right, Marissa? You and I, have had questions, and to bring in some answers now, we have a very special guest joining us, Dr. Mestre, who is Chief Medical Officer at Nicklaus Children's Hospital. Dr. Mestre, thank you so much for your time this afternoon.
Oh, thank you for having me. I really appreciate being on here.
So we just want to kind of share the message of what do you think, doctor, right now parents need to know as we look ahead to what we could have very soon as an emergency authorized use vaccine for elementary age kids. You know, what can parents expect here?
Yeah, so like as you mentioned, towards the end of October, the FDA, well, they're currently reviewing it now on FDA. Hopefully, it will come to some conclusion in terms of emergency use authorization of the Pfizer vaccine. And again, as previously mentioned, it's going to be at a lower dose. It's 10 micrograms as opposed to 30 micrograms, which is what the current vaccine has been used for those 12 and over. And as of right now, at least per Pfizer and their studies, it looks very promising in terms of an antibody response that we see in the children and protection from infection for those children as well. Most recently, it became even more important in terms of protecting these young children because of the Delta variant that we saw and the increased rise of infections that we were seeing, more so than we ever did in any time during the pandemic. And we were seeing an increase in children's hospitalizations as well. Again, I do want to reassure parents, though, even if your child were to get the COVID-19 infection, the great majority of them do very well and do not require hospitalization. Only about 1% of children require hospitalization if infected with COVID-19. But when you take 1% of a very large number, it becomes fairly significant. So this progress in terms of dealing with any future variants, I think, will be of great assistance in keeping our kids healthy.
Oh, Marissa, you're muted.
About that. What data, doctor, will the FDA be looking at when considering this emergency use authorization in a couple of weeks? I know there was a trial involving about 2,500 children. Can you talk to us about that?
Yeah, so it'll be looking at that, essentially that data, Marissa, just in terms of looking, number one, is it effective? And even probably more important, is it safe? The one thing that we were concerned about, especially as it relates to those adolescents that we with the 30 microgram dose, which again is 3 times higher than what was given in the study, is looking at things such as myocarditis, the inflammatory changes around the heart that has been seen in certain children, or adolescents, I should say. But thankfully, all those, or the great majority of those cases, have been very mild, and there have been no deaths secondary to the myocarditis. So the FDA will be looking in terms of looking at any side effects, such as myocarditis, and the effectiveness of the vaccine towards, number one, building an antibody response, and number two, preventing infection.
So when we're talking about so many more children, I think it's estimates are some 30 million more children could become eligible if we expand to this age group. We are seeing some positive signs of, COVID cases going down, certainly in Florida, and hospitalizations. What kind of impact, though, doctor, could it have now that we're able to vaccinate this age group of kids when it comes to fighting COVID and stopping the spread overall?
Sure. Yeah, so from our standpoint, what it means is that it's going to, number one, protect the children. So again, even though they do very well, it does put a strain on families in terms of having to keep a child out if they've been exposed or if they get sick themselves. So that's going to have a great impact as it relates to that. And compared to what we thought initially with the first variant and early on in the pandemic, we didn't think really that children could spread the COVID infection very much. And that's definitely changed with the Delta variant. We now know that children can spread this infection easily. So we definitely hope, and that's, to me, one of the greater effects is preventing other spread. I know we were talking earlier about us having children. I have a child that's 9 years old, and he is around some of the grandparents that, although vaccinated, could still be at risk. So for us, it's a personal decision as well in terms of helping our child feel comfortable in being around the older individuals or those who may be immunosuppressed, and in order to prevent any sort of spread of infection.
So, doctor, we're getting some questions in now from people who are watching. One of them says, of the 1% that are hospitalized, how many are obese or have pre-existing conditions? This is a question coming from Adina.
Yeah, great question. So when we have I'll give you just some data from what we've seen here at our hospital. In August and in July, we admitted to the hospital about 230 patients. Of those 230 patients, about half of them were in the adolescent age range, meaning from 12 and above. So about 120 or so were in that age range. And then of those, only one child was vaccinated, and that child was immunosuppressed. So it was on certain treatments that made that child immunosuppressed. So it has, even though vaccinated, was at increased risk. And they tended to be those adolescents. I would say about 20 to 30% of them had some underlying condition, mainly obesity. So those were the children that would get sicker. So those are the children that may require oxygen or further respiratory support. So definitely those that had underlying risk factors tended to be sicker. But most of the other kids that were admitted were actually healthy kids, and for whatever reason developed some respiratory type symptoms and required hospitalizations. We would even see neonates. So the youngest child that we saw here was an 8-day-old that was admitted to the hospital. The mother had contracted COVID right before delivery and hadn't been vaccinated, and then passed it on to the child shortly after delivery, and that child got fairly sick. So again, we see the gamut of age ranges from 8 days old to 21, which is our age range here in the hospital. So yes, those with underlying risk factors are going to tend to be sicker, but healthy children can be affected as well.
And was that a little bit of a surprise, doctor, that healthy kids were coming in getting very sick with Delta?
Yeah, and it was a little bit of a surprise, but again, kind of to what we were speaking to earlier, it was just the increase in that denominators. There were so many more kids getting infected that we just had a higher risk of seeing healthier kids getting hospitalized. Again, thankfully, not to the extent that we see in adults. So it was, though, in that higher numbers, but thankfully those healthy kids tended to do very well, even though they required hospitalization.
And doctor, that 8-day-old baby, did that baby get better?
Yeah, so they get better, and it took a while, but yes, thankfully everything worked out well.
Yeah, because and I know that has been a question for pregnant moms, right? I've talked to a lot of pregnant moms that yes, they want to get the vaccine, but they are just concerned about, something happening with their baby, their unborn baby.
Sure.
And it's
Sure.
kind of something they've had to balance. But what we're hearing from doctors is absolutely to get the vaccine. So what would you like to say to that? Pregnant moms maybe still on the fence.
Only as been recommended by the American College of Obstetrics and Gynecology is to definitely get vaccinated. We did see a big surge of pregnant women in ICUs secondary to the Delta infection. So again, we don't know when a Delta variant like this is going to pop up again. So we always recommend for pregnant mothers, even for mothers trying to get pregnant. I know there's a lot of misinformation out there that the COVID vaccine prevents or hurts your chances of becoming pregnant. That's not true. So even if you're considering getting pregnant, to please get vaccinated. For those mothers that are pregnant already, to also please get vaccinated if you haven't. Again, to avoid a situation, as I mentioned, with that 8-day-old child. And there actually has been studies indicating that there is passage of the antibodies onto the baby to protect the baby somewhat of any COVID infections after birth. Same thing with breastfeeding mothers. So if a mother's breastfeeding and has received the vaccine, those antibodies can be passed on to the baby as well.
And I have to say that is encouraging news for me. I'm a breastfeeding mom. My daughter is almost 10 months. And I have to tell you, doctor, it's the kids, that I'm most worried about, right? My sister and our families are vaccinated, but it's these elementary age kids and my son who goes to daycare. He's younger than 5, so his vaccine possibilities are further out on the horizon. But I know that even this next group of elementary aged kids, this makes an impact for kids right everywhere and the rest of us.
Yeah, most definitely. And I think not only to protect the child, again, one of the arguments you may hear from parents that are not considering giving the vaccine as well, if they get the infection, they'll probably do well. And they're 100% right. The likelihood that they'll have any complications from a COVID-19 infection is very low. But again, it's in that spectrum of, well, how do we affect the spread in the community? That child can then spread it to the infant, who then can possibly spread it to the mother, and that mother or father might be in contact with somebody else. So it's just a domino effect once you start looking at it in that manner. And that's why, from a public health policy standpoint, it makes sense to vaccinate these younger children. Again, number one, to protect them, although the risk of serious complications with them is low. It's not zero. And also to protect those other in our community.
And from Pfizer's reporting of the data they collected in that trial involving, I think it was 2,500 kids, something like that, that the side effects were very mild. I think it was, soreness and fatigue, right? So I know that that's something parents are really concerned about, what side effects, my child experience.
Yeah, the side effect profile that we've seen so far from the studies as reported by Pfizer are very similar to what we see with those adolescents. They didn't see any cases of myocarditis. Again, it's a little bit of a smaller study. So again, as we roll this out, we'll be keeping a close eye on it. But the risk of that occurring with such a low dose is also very low. And from what the studies indicate at this point is very similar, just as you mentioned. Could have some arm soreness, could have some fever, could have some fatigue that is related to the vaccine. But again, very minimal if lasting for more than 24 or 48 hours. Typically is the length of the side effects lingering on.
Is it fair to say it appears like that these young children are actually we're even seeing fewer side effects in them in this trial than with the adults?
It's very possible because of the lower dose. Obviously, they're going to be lower weight as well. But as you all can attest, and seeing children around, some 10-year-olds are the size of a 14-year-old, and vice versa. So with the lower dose, I think we're going to have that antibody response that we hope to get. And therefore, it's going to be the best of both worlds. You're going to have the response that you need to protect them, but also the lesser of the side effects secondary to the lower dose.
And doctor, we have another question coming in, also from Adina, saying, can children receive monoclonal antibodies? I know there's definitely an age limit there, so talk to us about that.
Yeah, so typically those children that can receive monoclonal antibodies, it's not just everybody. So first you got to be 12 years of age and above. You have to be over 40 kilograms, which is about 90 pounds. And then it has to be indicated for those that have any certain risk factors. So if you have a chronic illness, perhaps like diabetes or any other underlying disease that puts you at risk, then you would be a candidate to receive the monoclonal antibodies. Those individuals that are obese, so if you're over the 85th percentile for your age and height, those individuals would be at risk. So as we mentioned before, those are some of the individuals that we saw in the hospital. So those individuals would qualify also for receiving the monoclonal antibodies. Again, typically more commonly used in adults, but again is approved under emergency use authorization as well for those children 12 years of age and older.
And one thing that I've heard repeatedly from the medical community is that those monoclonal antibodies don't replace the vaccine, right? You shouldn't look at them equally.
Most definitely, and even now with although I haven't seen it mentioned for children, with the Merck medication that is being submitted for emergency use authorization, neither of those treatments per se or any substitute in terms of getting vaccinated. I always try to explain it to folks. There has been more data driven for the vaccine as it relates to any side effects or effectiveness as compared to the monoclonal antibodies. But some folks just jump to the monoclonal antibodies, and from a logical standpoint, you would think, okay, well, we have more information on the vaccine, and it seems to be more effective than any treatment of monoclonal antibodies. So you're exactly right. It's not a replacement. I always say it's another tool in our toolkit to fight COVID, but we want to start with prevention first, and the only way to prevent things is by the use of the vaccine.
Doctor, what would you say is maybe your outlook right now? I mean, I have to say, with just keeping an eye on, like, I watched Jackson Memorial Hospital tweets out their COVID patient total every day, and it has been slowly declining. The cases now, not everywhere, not in all states. I know in some states, Alaska and some of the upper Midwest, they are seeing a rise. Thankfully, though, in our state, we're seeing a decline. Am I right to feel positive about that? Or tell me your thoughts about, as we have those factors plus the potential for this vaccine of elementary age school children, what's your outlook based on?
Yeah, definitely have a very positive outlook on things, and you're 100% right. Things are looking tremendously better as compared to a couple months ago when we were in mid-August, when we were hitting our peak. So as Jackson Memorial and Baptist Health and us here, we've steadily seen a decline of patients being admitted to the hospital. So things are definitely looking better from that aspect. But as we learned with the Delta variant, we can't let our guard down. It's something that we want to get back to as normal as we can be. But the only way to do that is by having high vaccination rates across all the age groups and making sure we protect our community. And also, now coming up with the flu season, that's something that does make me worry a little bit in terms of how is this going to combine with the flu and COVID and our co-infections at higher risk. Last year, we didn't have much, if any, of the flu. But this year, with less restrictions and kids being back in school, I suspect that those individuals that have co-infections may be a little sicker. So definitely recommending to folks, not just with the COVID vaccine, but also making sure that they get their flu shot as they should every year.
And one thing that we should certainly be doing, especially knowing that this vaccine might get approved in just a few weeks, is to talk to our kids now, right? We don't want to wait until a day or two before they may be going in to get the vaccine. What things should parents be talking to their kids about?
Yeah, just mainly talking. I always explain to parents not to instill fear. That's something that we don't want to do either as physicians, is instill fear, but to be respectful and understand that this virus is something that we have to deal with, but nothing to fear. And we do have the appropriate tools to do this. And as mentioned previously, kind of looking at almost like your regular flu shot, kind of your vaccine to protect those individuals. And I go back to my 9-year-old. He's waiting to get it just so he can freely go and hug his grandmother and grandfather and not have to worry about things as much. Because again, kids can pass the infections, and we do make sure that he understands it's not just for his own safety, but for the safety of those around him, and to make sure that he's there. The children are doing their part as well. I do emphasize that for adults, though, that I hate to put all the burden on children. That we as adults also got to promote that we adults get vaccinated.
And one of the things, and you touched on this, obviously we know kids with underlying risk factors, they may get sicker, but and as you said, the vast majority of children thankfully do very well, but that 1% that don't do well. And what troubles me is that it may be a perfectly healthy child. You don't know if it's going to be your kid who doesn't handle COVID well.
Right. And similar to other types of infections, again, any sort of infection is going to have a higher risk factor with anybody that has any comorbidities, obesity, diabetes, whatever it is. Any infection has that same profile. And similar to the flu, most children do fine with the flu, but we do see our more severe cases. And now with the flu coming in conjunction with COVID, we haven't really seen that. So in terms of the unknown, I'd rather be protective and play on the safe side of things, and just have folks protected against both viruses in order to prevent any serious complications. So you're exactly right in the standpoint of it could be anybody. Chances are low, but it can be. And if we can do something that has a very low risk side effect profile, we know it doesn't have long-term complications in terms of what you hear in some of these points of misinformation, fertility, pregnancy, and whatnot. It's very safe and effective. Well, why not do it? The risk benefits, the benefits are so much greater than the risks.
And I know we've kind of been focused on the 5 to 11-year-olds, but what about the kids under 5? I know there's, studies going on right now to see what dosage works best for them. What do you think the timeline is for parents who may be listening with kids under the age of 5?
Sure. Yeah, that'll probably be going into 2022, and maybe perhaps in the first quarter of 2022, we may see some more information as it relates to that. Again, for children that are especially in that age range in daycares, again, children will probably do well if they were to get infected, but this affects just kind of your daily living. Having a mother to be able to, or a father having to stay home with a child that's for 10 days because of an infection or an exposure, that affects just kind of common daily living, and not even to mention just the regular health of the child. So I think that's going to be a big boost as well in terms of protecting our communities and protecting the individuals.
Well, and imagine, Joel, if we don't have to pull our kids out of school because another kid, was exposed. Knowing if your child is vaccinated, that'll just make that so much better. I mean, quarantining, a lot would change.
Yeah, absolutely.
Most definitely. And I think a lot of it, we don't take into consideration sometimes, and some of us, thankfully, are fortunate to have other forms of childcare that we have available, but a lot of folks don't have that. And for those that may be socioeconomically deprived in that sense, just makes things even worse. So those type of things from a social aspect are of great assistance in terms of being able to maintain what social function that we have and keep it as normal as possible.
Sure. And Doctor, one last question. you know,
Sure.
with things getting better in general and hospitalizations going down, infection rates going down, I think there are probably some parents out there who are like, you know, do I really need to get my kid vaccinated? If things are getting better, how about I just wait this out? What would you say to that mom or dad?
Yeah, at this point, just with, I think Delta taught us a lot in terms of not being complacent. In terms of getting the vaccine and getting to a level of protection, you need about, at the very minimum, about 6 weeks. So you get or probably 5 to 6 weeks. So you get your first dose, and you have some immune response, but then you have to wait at least 3 weeks until your second dose. And then after that, it's not until about 2 weeks after that that you're somewhat protected in terms of infection. So you're talking about a 5-week time frame, and something that just kind of comes up pretty quick as a Delta variant kind of snuck up on us here. So at that time, it's almost too late. So for us, I always say you want to be ready before something occurs, just like we do with the flu vaccine, that we kind of make sure that we recommend to get it done now, as opposed to when we're in the height of flu season, so your body is able to mount that response in order to protect you. So I always say better earlier than later, when it might be too late in terms of getting the vaccine.
Well, thank you so much, Doctor, for all your expertise. I hope we were able to answer some questions out there for parents. It's often can be such a big topic you're trying to tackle, and when it has to do with our little ones, you know, the 5 to 11-year-olds in particular, it's a lot to take in for parents.
No, most definitely, and to that point, what I always tell folks is not to pass judgment, just provide information and answer questions. Once we start passing judgment, I think it pushes folks away. And any questions that you have, I always recommend going to the CDC websites. You can go to our Nicklaus Children's Hospital website as well to have questions answered, or even send in your questions.
And seek out your pediatrician, right? That's your best
That's right. Most definitely.
resource, I think.
Yeah.
All right, doctor, thank you so much. It's been a pleasure. Great
Thank
to
you
have
for
you.
having me.
Hope to
Thank
see you
you
in
for
person sometime soon.
That's right. Thank you for everything you all do. Appreciate it.
Thank you. Thank you for what you do, doctor. Appreciate the support of your hospital. All right, everybody. And thanks for watching Moms with a Mic.